The process of formation of red blood cells. Yes, poiesis, poietic formation. And what's the hormone that stimulates the formation of erythrocytes? Hmm? No, calcitonin is for calcium. The process of erythropoiesis. What's the name of the hormone? It's very close. Yes, erythropoietin. It's erythropoiesis. So the hormone is erythropoietin. I told you guys these are the basics. Okay, if you don't know, you need to put more time. Okay, it's called erythropoiesis. So it's a hormone, erythropoietin. It's a same word. And where does it come from? From the kidney. And when does the kidney secrete erythropoietin? When low oxygen and low blood. Basics. Low oxygen, low blood. The kidney will say, okay, since does that make sense? The kidney will say, I'm not getting enough blood, I'm not getting enough oxygen, so we don't have enough. I'm going to secrete my hormone to make more. It's just common sense. Just think about it this way. All right? So, what else does the kidney secrete beside erythropoietin? There are another two, renin. And what does the renin do? Activate what? Huh? No, activate a specific product. And angiotensinogen to angiotensin 1. Angiotensinogen, remove the gen, it becomes angiotensin, which increase blood pressure. Okay? I always ask to make sure that you guys are following. If you're not following, understandable, put some more time. Understand that you don't know the basics. I'm not going word by word, as you know. So you should know all what I'm talking about. What's the third one? We got two so far. Erythropoietin and renin. What's the third one? Not calcitonin. It's very close. Calcitriol, yes. Calcitriol. Calcitriol. And what's calcitriol? Active vitamin D. Active vitamin D. Okay? So these are the three things that the kidney secrete. So now in order to make the blood, we need different things. Let's think about it this way. Red blood cells. What's a red blood cell? It's this spherical, not spherical structure, biconcave structure that contain hemoglobin. So if you want to make the hemoglobin, or if you want to make the RBCs, you need to make hemoglobin and you make a membrane around it. Make sense? This is what you need to do. So we need to do hemoglobin. Think about it. What do we need to make hemoglobin? Hemoglobin. Globin is a protein. I need amino acids. How about the heme? Iron. Do you remember the four ferrous or four iron, each one of them attached to one oxygen? What do you call it when oxygen attached to hemoglobin? Oxygen attached to hemoglobin. Just put them together. Close. Oxyhemoglobin. Oxygen with hemoglobin. Oxyhemoglobin. Okay? So what do I need here? I need amino acids to make the globin. And then for the heme, I need iron. These are the basics. Hemoglobin. For the heme, I need iron. For the globin, I need amino acids. Okay, this is one. Now you're making the red blood cells. In order for these red blood cells to grow, what's the mother cell for the red blood cells and for all blood cells in general that I told you to remember? Yes, hemocytoblast. Hemocytoblast. So you start with hemocytoblast and you go myeloid and lymphoid stem cells, and then you go step by step reticulocytes until you get the mature red blood cells. Does it have nucleus? No, it doesn't have nucleus. Does it have mitochondria? No, it does not. This is the red blood cells. As it is growing or as it is developing or maturating, It gets smaller or larger? Smaller. And then it loses the nucleus. Then we get the red blood cells. Is that clear? So this process, one by one by one, the process of maturation, in order to do that, you have to have vitamin B12 and folic acid. What if I don't have vitamin B12 and folic acid? You're not going to maturate. You're going like hemocytoblast to myeloid stem cells, and then you go to the pre-reticulocytes, and then that's it. You're going to stop. So the cells will become bigger, right? Here it is. It's big like this. Maturate, smaller. Maturate, smaller. Maturate, smaller. If you're big, in order to maturate, you need those two vitamins. If you don't have it, do you stay big or you get smaller? Stay big. So what do we call it if you don't have vitamin B12 or folic acid? Both of them needed for this process. It's anemia. You will not have enough functional red blood cells, right? And this is anemia. What kind of anemia? Anemia with the cells big or small? Big. Big means megaloplastic anemia. For iron, if you don't have iron, you don't have hemoglobin. So the process is not, the problem is not the maturation. The problem is the red blood cells itself does not have enough hemoglobin. So would the cells be smaller or bigger? If this is the red blood cells, it's fully maturated, it's over, here it is. But I don't have enough iron, so I don't have enough hemoglobin. The cells become smaller. So we call those microcytic anemia. So we have two types of anemia. The anemia with big cells, the anemia with small cells. In both cases, it's anemia anyway. You don't have enough hemoglobin. That's it. You don't have enough hemoglobin. Anemia. What kind of anemia? That cells are big because it's not maturated, megaloplastic or macrocytic anemia. How about if the process, I have vitamin B12, I have folic acid, everything is okay. So the process of maturation is going as normal, right? And you go all the way until the end. Not the problem now. The problem now, this final product, which is red blood cells, we don't have enough iron. So if you don't have enough iron, you don't have enough hemoglobin. You have smaller amount of hemoglobin. The cells are smaller, microcytic. Does it make sense? Micro versus macro or megalo. Clear? Did you get this point? Okay. So this is for your information. And this is actually when the cells are big like this, and it's because of the vitamin deficiency, we call it pernicious anemia. Pernicious is kind of like malignant. It's not really malignant. It have nothing to do with malignancy. This is sometimes they put names and then they find out that this was wrong, but sometimes they keep it. Like brain natriuretic peptide doesn't come from the brain. No, it comes from the ventricles, from the heart. Why did you call it brain? They didn't change the name. So have to take it as it is. Pernicious anemia, is it really pernicious? Is it like malignant, or is it something that cannot be fixed? No, it was. It was. Why did you call it this? Because they couldn't fix it. They tried to work on it. So this person, like let's say 500 years ago, and you have this person having anemia. So all what we know is it might be like amino acids or iron. Give him amino acids, no change. Give him iron, no change. So this case is malignant or what? Okay, this is how they think about it. We cannot fix it. It's pernicious. But later, they found out that it's because of the vitamin B12 deficiency. The problem is the vitamin. You give him the vitamin, he will be fine. So it's not really pernicious, but we still have the name, so we still use it. Pernicious anemia. It's not anymore. If you have vitamin B12 deficiency, I'll give you the shots and it will be fine. It's not really pernicious. But again, we're keeping the name. Now the difference. Oops. The difference between those, again, this is just for your information. You don't have to remember that. It's just the only difference is iron. Most likely, you don't get enough in the food. Vitamin B12 deficiency, this is not the issue. We all get enough vitamin B12 because you need very small amount. So what happened then? Why are we getting anemia of vitamin B12 deficiency while we're getting enough vitamin B12 in the food? You don't absorb it. This is the issue. You don't absorb it. Why? Because there is a factor that's secreted from the stomach. Without this factor, you cannot absorb vitamin B12. No matter how much I eat it, yes. So I eat huge amounts of vitamin B12. I still get anemia. I still get deficiency. Yes. The issue is not that you're not eating it. This is the iron. The problem is you get it. You eat enough. You eat more than enough, but you cannot absorb it because of this intrinsic factor coming from the stomach. Okay. All right. So next is recycling. What's the life span of the red blood cells? The average 120 days or 4 months. It's the same thing. 120 days, 4 months. So what happened after the 120 days or 4 months? Here is what happened. 120 days. These red blood cells leave the blood and go to the liver and spleen. In the liver and spleen, there are the big eaters, the macrophages. They are going to engulf and eat the red blood cells and break it down. It cannot live more than that. And you should get rid of it. We don't really get rid of it. We don't throw it away. No. These macrophages in the liver and in the spleen, they eat red blood cells, they break it down. And what was the red blood cells? What do we have inside the red blood cells? No, what do you call it all together? What's the contents? Hemoglobin. What do you have inside the red blood cells? Hemoglobin, isn't it? Hemoglobin. And what's hemoglobin? Hemoglobin. Globin is protein, and heme contain iron and something else, but not our issue. So what should we do now? Do we throw it away? No. We take the iron back, give it to the red bone marrow, reuse it, recycle it, and we take the protein and amino acids back, red bone marrow, reuse it, and then we end up having some remnants. Okay? And remnants, we will get rid of it. But what are we recycling, reusing? Two things, iron and amino acids. Why would you throw away iron? We recycle it. You have it already. Don't throw it away. Take it back. So if that's the case, you are going to recycle those two and get rid of the rest. The rest is going to change into something called biliverdin, which will become bilirubin. Did we hear about jaundice? Jaundice, the yellowish discoloration. It's because of this. The remnants, what's remaining that you don't need it, you get rid of it. The remnants become something called biliverdin, which is green, and it turned to be bilirubin, which is yellow. If that accumulated, it's jaundice. And that's enough. I don't want to go more than that. Now, what if I have extra hemoglobin? Makes sense that we call it hemoglobin, go to the urine. So what's the name? Hemoglobin urea. Hemoglobin urea. Hemoglobin in the urea, like glucosuria, glucose in the urine, amino acid urea, protein urea, anything urea, you throw it in the urine. Make sense of the name. Don't take it as it is. Versus hematuria, hemato is not as the same as hemoglobin. Hemoglobin is the contents of the red blood cells. Hemato is the red blood cell itself, the whole thing, including the membrane and the whole cell. Is that clear? The cell, the whole thing, the cell with the membrane and everything. This is called hemato, the whole cell. But if you're talking about the contents only, the contents are called hemoglobin. So can we have hemoglobinuria or hematuria? Yes, these are two different things. Either you already broke it down and you have extra hemoglobin, it goes into the urine, we call it hemoglobinuria, or some cells can appear in the urine. So if you go to the lab and they take a sample of your urine, they can see hemoglobin and they can see actual red blood cells. These are two different conditions. Here is what I was just talking about. We are going to take iron back. We are going to take amino acid back. Back to what? Where do we send it to? What's the factory? Red bone marrow. You can't say bone marrow. Red bone marrow specifically. Do we have another color? Yellow. Does the yellow make red blood cells? No, it's just for storage. We store fat, right? It was all red blood cells in children. But now, is it all red blood cells inside your bone? No, some of it is yellow, right? So we're talking about red bone marrow. So simply, I take the iron back, send it to the bone marrow. I take the amino acids back, send it to the bone marrow. Obviously, the bone marrow is going to take those two and rebuild or remake other cells. Clear? Okay, now what about the remnants? The remnants are going to become something called biliverdin. It's something green. Remnants that it is green in color. This in the liver will change into a yellow structure called bilirubin. So what's a bilirubin? It's like a trash. We get rid of it. Where do we get rid of everything? Urine or stool, right? This is a trash. So yes, we get rid of it in the urine, we get rid of it in the stool. What if you have too much that you cannot get rid of it? It will accumulate. Make sense? Right? If there's trash and you get rid of it, trash, you get rid of it. If it's too much trash, you cannot get rid of all of it and start to accumulate in the house, right? Bilirubin start to accumulate in the blood. It's yellow. So it's spread in the body and your body looks like yellow because of high bilirubin. And we call this condition jaundice. Actually, people, it starts like in the eye. If you look at somebody's eye and see like the white is becoming yellow and his lips are becoming yellow, and then if he stayed more, his skin will have this yellow tinge. You know right away that this is jaundice. His bilirubin is building up. Can be different things, but I don't want to expand more. So what are we going to do with the iron that we removed? This iron is going to uh, we put it together with something called transferrin, which is a carrier. Do you remember the carriers? The plasma proteins? Which plasma proteins are carriers? Huh? What is it? No, no. The plasma protein. How many plasma proteins do we have? Three. Globulin, albumin, and a third one is fibrinogen, right? Fibrinogen. The first two are transport or carrier. So it should be one of those. Well, what is the function of the other function of albumin besides being carrier? Yes, somebody said it. Osmolarity. Yes, osmolarity. And what's the other function for globulin beside being transfer? Huh? Yes, immunoglobulin, which is antibody. Okay, I'm asking you basic questions. This is what you're going to see in your exam, and that's why I'm asking you. If you don't know, it means you're not going to do good in the exam. Put some more time and study more. That's it. That's why I'm asking. I'm not wasting the time. Okay, this is like consider it like a quiz. Okay, it's not a real quiz. There are no points, but just make sure that you are following. You know the answers, you're good. You do good. You don't know, you're not ready because I'm not asking you something that's really hard or something that we didn't talk about or something that's very deep. I'm asking you about the basics. I told you there are three types. I'm going to ask you about them. I told you already, right? There are three types of plasma proteins, and I will ask you about it because these are basics. If you don't know, you need to study more. Okay, and that's the purpose of saying that. So, how are we going to transfer it? Transferrin, translation. Trans coming from transfer. Ferrine is ferrous, which is iron, the iron transporter. Okay, the one thing that transport the iron. To take it to what? I take it to the red bone marrow to reuse it. What if I have more than that? Like, okay, I take it, transfer it to the red bone marrow. What if I still have some more iron? Can I store the extras? Yes, you can store it in the form of ferritin, or hemostadrin, and this is stored in the liver and spleen. So here is the whole thing. Here is the red blood cells, 120 days, send it to the, what are the two organs that break it down? It's actually three, but this is more important. Liver and spleen. In the liver and spleen, we have macrophages. They're going to eat it, break it down. Hemoglobin. What do we get out of the heme? Iron. And what do we get from the globin? The amino acids. And we send it back to the bone marrow to reuse. Here it is. So there is heme and there is globin. Globin, amino acids, take it back. Heme, take the iron, take it back. I got the two important things back. How about the remnants? Biliverdin, which is green, bilirubin, which is yellow. We should get rid of it in the urine or stool. If it is too much, it accumulates in the blood, and we call this condition what? Jaundice. So here is the iron going back. Here is the amino acids going back. Then you remake new red blood cells to replace the old ones. Is that something good or bad? It's definitely something good. Why? Because this is the maximum. Like if you have a car and you're using it for 10, 15, 20 years, is it going to still like continue working, or it will break down ultimately, right? Ultimately, you will need a new car. Otherwise, it will not do the job. Same thing here. The red blood cells, after 120 days, they will not do the job that you want. Just break them down and make another cells. Okay? And here is how we get rid of the biliverdin. Biliverdin, it goes in the bile and it goes to the intestine, go to the stool, and part of it absorbed, go to the blood and go to the kidney. So how do we get rid of it at the end? Urine and stool. Urine and stool. Next is the blood types. Understand this, and I will try to make it as simple as possible, right? Why our defense, our body defense, why our immune system does not attack our own cells? Like, do you hear about somebody getting wrong blood and the blood getting destroyed? It's incompatibility, right? We hear about this. Do you hear about somebody getting transplant and it gets rejected? Doesn't work. Why? Our immune system or the body defense attack the foreign bodies. How did the immune system know that this is foreign body? There is something called self-recognition. Yes, but there is something called antigen. Antigen is simply identifier on the surface of all our cells. Every one cell has this identifier. How the mail delivery know that this is your house? I'm delivering the mail and I know that it is 23554 Ford Road, for example. How did I know that this is the right address? There is an address, right? There is address on the building or address on the house. The address on the cells is antigen. Clear? This is the identifier. So if this is the immune system and I go around, I will find this is my red blood cells. There is an address on it, which is the antigen. Okay. While we are in fetus, the immune system literally memorize all the antigens. So if you show him something, let me see, red blood cell. Let me see the antigen. Oh, this is my red blood cells. I have it in my memory. Okay. Liver cells. Yes, this is my liver cells. Right? White blood cells, spleen cells, any cells, all cells, no exception. Every single cell in the body have an antigen, which is identifier. So the immune system memorize all these antigens. Okay. So if you give the body if you give the body different cells, they will have different antigens, right? Every single one of us has his own antigen. Every cell have the antigen, and the immune system know. He memorize it. Okay, so if the immune system, the white blood cells going around, and I see these red blood cells, I will go around it. Let me see the antigen. Ah, this is my antigen, which is called self-recognition. I know myself. I know myself. And uh, sometimes, we'll talk about it, it's coming. Sometimes there are issues that the immune system does not recognize his cells, and he attack them. Does anybody know what do we call this? Not immune deficiency. There is a name for it. You attack your own cells because you forgot it. Like I see my joint cells and I look at it. What are these cells? Let me see the antigen. I don't know what is this. Forgot. So you attack your own cells. It's called AU autoimmune. Autoimmune. It's called autoimmune. Okay? And this is how exactly how it works. So let's talk about the blood cells. Blood cells, red blood cells, just like any other cells, they have their own antigens, right? Okay, the name of the red blood cells come from the antigen. This is the simple way. Okay? Come from the antigen. If you are type A, what kind of antigen do you have on your red blood cells? A. If you are type B, what antigen? B. If you are AB, what kind of antigen? AB. What if you're type O, which is 0? No antigen. Clear? This is how we call the red blood cells. So if they tell you your red blood cells are AB, translation, my antigens are both A and B. Clear? Okay. Next, if you are type A, this is your type, this is your antigen. Do you attack your own cells? Are you supposed to attack your own cells? No. So when you produce antibodies, if you have antibodies that fight for you, would you have antibodies against A, against your own antigen? No. You will have antibodies against the foreign ones. And this is the antibody, which is the opposite of the antigen. Translation, I'm type A. What kind of antigen do I have? A. And what kind of antibody? Is it A? No. It's what? The other thing, which is B. So the antibody will be anti-B. It's called anti-B. Next, my blood type is B. What kind of antigen? B. And what kind of antibody? Anti-A. A means anti-A. Clear? What if I, like myself, I know I am AB. What kind of antigen do I have? Both of them, AB. And what kind of antibodies do I have? Nothing. Nothing. I don't have any antibodies. What if I'm type O? O means 0, by the way. O, 0. So what if I'm type O? What kind of antigen do I have? I don't have antigens. Can you give me to anybody? Yes. Like if give you type O, why would you attack O? It doesn't have any antigens. You attack the antigens. Clear? Right? Okay, how about type AB? What do we call it? What's the other name for it? Universal what? Universal receiver. Why? If I'm type AB, what kind of antigen do I have? A and B, what kind of antibody? Nothing. Can you give me anything? Yes, I don't have antibodies. The antibody is a weapon. Okay? This is your bullets, your weapon. So if I give you, if I'm AB, I don't have any antibodies. You give me type A, I don't have anti-A. I take it. You give me B, I take it. Right? You give me O, I take it. If you give me any type, I have 0 antibodies. So you can give me anything, and that's why we call it universal receiver. How about the O? We call it universal what? Donor. Why? It doesn't have any antigens. There are no antigens. So can you give it to anybody? Of course. If I give it to you, why would you attack red blood cells that have 0 antigen? You don't. You attack if you know that these cells are foreign. Is it foreign? Yeah, it's foreign. How did you know it's foreign? Do you think like your system is very smart to guess where did you get it from? Of course not. Your system is programmed. Show me the antigen and I will know if this is foreign or not. No antigen. Okay, I'll take it. Right? So these are the different blood types. We do have another antigen though. It's not just the antigen A and antigen B. But did you get the first part? We'll go to this. Okay. The other antigen is called D. It's something completely different. This is not part of typing. Okay. So this antigen is called D. And this time, it's either you have it or you don't have it. There are no types. Like for antigen, I told you you can have A, you can have B, you can have A, B, or nothing, right? For this, it's yes or no. You have the antigen or you don't have it. If you have it, you're positive. If you don't have it, you're negative. So if you put those two together, now this is your blood type. Like if you ask me, what's your blood type? AB positive. Translation. AB, I have the two antigens. That's AB. Positive, do I have the antigen or I don't have it? The D. I do. And this is called the RH. RH. So here it is, type AB, ABO. You got it? The name comes from the antigen. And then the RH positive and RH negative. You either have the RH, which is D. You either have the RH or you don't have it. If you have it, you're positive. You don't have it, you're negative. Clear? So when I ask you what's your blood type, or if you ask yourself what's my blood type, it's two components. You don't just say A. Yes, A what? A positive or A negative? Okay? We always say it this way. So it can be positive, it can be negative. Yes.
So like people with type O don't have antibodies?
They do have the antibodies, both of them, but they don't have any antigens.
They have A and B
Yes.
antibodies.
Yes. And that's why it's an issue for them. Like these are the nice people that can give to anybody, but they cannot take from anybody except his own type because they have both antibodies. If you give me A, I will fight it. If you give me B, I will fight it. If you give me AB, I will fight it. I have both antibodies. So what can I take now? O. If you're O, you can take O. That's it. Unfortunate, but that's what it is. Yes.
Like I was always confused on, I was trying to figure out, so O's only can get O, but O can still give everyone.
Yes.
Like A and B.
Any other type. You O can give O and A and B and AB. There is.
Does that also like, does it matter?
No, it does. If it is negative, this is the universal donor. You don't have, it's not only that you don't have A and B, you don't even have the RH. So anybody can take you and there is no issue. O positive, yes, O positive, you can get the O positive, and you can get the negative. If you're negative, you only have the negative. You only get the negative. Because if you get the positive, you're going to fight it. Clear? Is that clear? Okay. These surface antigens that I talked about, it's called agglutinogen. Why did you call it agglutinogen? Because of something called agglutination. What's agglutination? Agglutination is if I give you a wrong blood type, your antibodies are going to attack it, and then they come together, making like a blood clot, and we call this agglutination. Blood cells coming together, agglutination. Got it? So that's why they call it agglutinogen. Tenogen is coming from antigen. And agglutinin is the antibody. This is the other name for it, and both names are coming from the process of agglutination. Okay, so if I give you wrong blood type, if you type A, I give you B, you get agglutination. You get agglutination. Is that clear? So what I mean by that? Your antibodies are going to attack, and these cells will come together. We call this process agglutination. If I look under the microscope, I will see like red blood cells, but then I will see like accumulating cells together like this. I know this is agglutination. So here is the antibodies, and I mentioned it. I put everything in the beginning. If you understand, everything will just come smoothly. If you are type A, I have A antigen. And what antibody? B. We call it anti-B. Okay. If you're type B, what kind of antigen? B. And what kind of antibody? A. If you are O, zero what? No antigen. What kind of antibody? Both. Both A and B. What if I'm type AB? What antigen? A and B. The name comes from the antigen. And what kind of antibody do I have? I don't have any antibodies. And that's why I can take anything. RH can be positive, you can be negative, and this is the process of agglutination that I was talking about. I mean, it's coming. This is type A, type B, A, B, and O, and I told you already what does it mean. The name come from the antigen. Remember this sentence. The name come from the antigen, and you will answer any questions. So what if I give you transfusion, wrong transfusion? There will be something called cross reaction because you are giving something crossing, meaning it's not the same type. Your A, the cross transfusion is B or AB. I'll give you something different. So this transfusion, if I give you the right type, we call it compatible. Compatible. What's compatible with B? B only? NO. This is called compatible. It means if you give it to him, he will be fine. Compatible. What if I'm type A? What can you give me? What's compatible? A and O. What if I'm AB? What's compatible with me? All of them. Everything. All of them are compatible. If I'm type A, what's incompatible with me? And B. B. Right? So this is incompatible. If I give you incompatible blood, so if you need blood, it has to be compatible. Okay? Means it goes with your type. Incompatible, there will be an issue. The cells will be attacked by the antibodies. They will clump together. We call it agglutination. And these red cells will definitely or ultimately will be broken down. And we call that hemolysis. Hemolysis. What's hemo? Blood. And what's lysis? Breakdown. Breakdown. So what's hemolysis? The blood breakdown, right? So look at this. If let's say this is type A, so what kind of antigen is antibody is this? If this is type A, B antibody. If I give you type B, the anti-B will fight it, right? Look, they will come together like this. We call it agglutination or clumping, and then hemolysis. It will break down. And these are the consequences of giving you a wrong blood type. Okay? So usually we do the matching first. If you know your blood type, that's okay. If you want to donate blood to somebody, if you know your blood type, that's okay. You should know. I know I'm AB. This is important information. You should. But if you don't know, we can test it and see if you're okay or not. But what if I have a patient right now, emergency, if I didn't give him the blood in like a minute, he might have organ failure. I will just give him O. So they have O everywhere. Okay? I'm not going to wait. So here it is. If you're type A positive, it means you have antigen A and you have anti-B. Okay? B, you have antigen B and antibody anti-A, and so on. Here is a condition that can happen to pregnant ladies. It used to happen, but nowadays it doesn't happen anymore for a reason. If this is a mom that's having blood Rh negative, irrespective of the actual blood type, Rh negative, what does it mean? Does she have antigen or not? It means she doesn't have the antigen. So she has the antibody? Yes, she have the antibody, right? If you don't have the antigen, you will have the antibody. Make sense? If I'm A, I will have antibody for B, for something different. So here's a condition if this is a pregnant lady and she is Rh negative. She doesn't have it. Okay, Rh negative. And if the dad, the father, is Rh positive. In genetics, Rh positive is dominant to Rh negative. If the two parents, one of them is positive and one of them is negative, the child most likely, not necessarily, most likely he would be positive. So if that's the case, and here's the dad that's positive, and the mom is negative, and she's pregnant, and the fetus inside her uterus is positive, like this. So what's going to happen here? Is this fetus have the antigen? Yes, it's positive. He has the antigen. The blood doesn't mix in the very, very beginning, but because there is a barrier between the maternal blood and the fetal blood, okay? But toward the end and closer to the delivery, some blood get mixed up. So the mom gets some of the blood of the baby. It start the process, the barrier start to break down, and a little bit of the blood from the fetus go to the mom. So what's the issue now? The mom will get this antigen as a foreign body, right? And she will make what? Antibodies, and will keep it in her blood. It will stay. These antibodies doesn't like we don't get rid of it immediately. It stay for a long time. So what's the problem now? The problem, the first baby is born, everything is okay, but the mom accumulated the antibodies. Second baby is the issue. Why? Because during that time, toward the end, the mom already have the antibodies, right? And the fetus already have the antigen. The antibody will attack the antigen, and this can lead to death because he's losing his blood. Did you get the idea? So, what do we call this whole scenario for the second baby, not for the first baby? The first baby is totally fine because the mom was never exposed to that. She's totally fine. She doesn't have any antibodies. So she's okay. Okay. First baby is born, he's okay, everything is fine. The second baby, she already accumulated antibodies, and the baby is positive. He does have the antigen. So the antibodies that's already there will attack that baby, and we call that erythroplastosis fetalis. And you should remember this name. Erythroplastosis fetalis. Fetalis is coming from fetus. Erythroblastosis, the breakdown of the blood. Erythroplastosis fetalis. Remember this name. Okay? So in reality, this used to be the case. Believe it or not, they used to tell the mom, you can be pregnant one time only. Okay, but that's not the case anymore. Why? Because there is something that if of course it goes without saying that if this is a pregnant lady, they know the blood type of the mom and they know the blood type of the baby automatically. This is like something that goes without saying. So I know automatically. If I am the doctor, I'm following up. You're following up with me. I will automatically get your blood type and the baby's type. And I know that you are negative and he's positive. So I'm going to tell you this. Listen, the first baby will be okay. After birth, come back to me. I will give you shots, and these shots are called ROGAM. Did we hear this name before? ROGAM. This ROGAM will clean it, the antibodies. Zero. Get rid of it. It's a shot that's made specifically to wipe it off. So now what happened to the mom? Does she still have any antibodies? Zero antibodies. So the second baby or the second pregnancy is just exactly like the first baby. And we'll start the process again. So does the second baby will have issues? No. But toward the end, the blood of the mom will go, making antibody and store it. So the third baby will have the same issue, but that's okay because after the second baby is delivered, we will give him the ROGAM, wiping off, cleaning all these antibodies. She will have zero antibodies, no issues. Make sense? Erythroplastosis fetalis. You should remember this. Erythroplastosis fetalis. Of course, you guys know that what I'm telling you is enough. Okay? If you want to read anything else to further understand that, that's fine. But what I'm telling you is what you have to know. And that's what I'm going to ask you next time. just to evaluate yourself. Okay. The next type is the white blood cells. Uh, Red blood cells have nucleus or not? No nucleus. The white blood cells, they do have nucleus and mitochondria. And they have different functions, but the function will depend on the type of white blood cells. Do you guys remember the white blood cells? We have 5 types. Can anybody remind me what the types? Monocytes, eosinophils, lymphocytes, neutrophils, basophils. Yes. Men, men first. What did I say about men? The eaters. Good. The eaters. Men. The men like to eat. Men like to eat. Remember it. Men. Monocyte, eosinophil, neutrophils. Clear? So these are the eaters. You got 3. What's the other 2? Lymphocytes and basophils. Each one of those have a specific function that we have to know. The white blood cells also, just like anything else in the blood, it's also connective tissue. And the normal number is 5,000 to 10,000. Remember this number? I told you a couple of numbers that you need to know. What is the pH of the blood? What is it? 7.35 to 7.45. What's the normal temperature of the blood? 38, not 37, right? It's not 37, 38. This is the core temperature. It's not the skin. Skin is 37, but the core is 38, right? What's the average for red blood cells? 5 million. What's the average for this? 5 to 10 thousands. You see the comparison? There is no comparison, right? We're talking about thousands versus millions. And that's why red blood cells are 99% of the blood. Okay? So this is a normal number. And the white blood cells have some characteristics. They can migrate, they can go like in the blood like this, and then you can get out of the blood to go to other in between the cells. They can do this migration process. And in order to do that, remember when I told you that the red blood cells are very flexible, so they can pass through even the capillaries that are very tiny, right? For the white blood cells, they are even softer and they are extremely flexible to the extent of they can get out of the blood from smaller than the capillaries, just the tiny openings. They can get out of it because they can leave the blood and come back. These are the defenders. These are the cleaners. They clean not only the blood, they clean anything. The white blood cells are your soldiers. They fight for you. They protect you. They clean everything for you. So they have this amoeboid movement. You guys remember the amoeba? These cells, they're very flexible and they can like make extensions and right? It's like this and it can squeeze itself and get out. This is called the amoeboid movement. They also have positive chemotaxis. What's the chemotaxis? Chemo is coming from chemicals. Translation, get the translation. Taxis is attraction, medical terminology. What's the chemotaxis? Chemicals that does the attraction. What do you mean? I mean they talk to each other. If I encounter something, if I'm the macrophage, I encounter something, I will release these chemicals to bring more white blood cells to me to attract them. And we call that chemical attraction. What's the medical name or scientific name? Chemotaxis. Chemical attraction. Chemotaxis. Okay? Okay, here's exactly what I want you to know about these 5 types. First thing is something that I already mentioned. MEN. What are these? The eaters. What's eaters means? Not macro or micro, not yet, but what do you call, generally speaking, the eaters? What does it mean? Phages. Phages. Just phages for now. Okay? Okay, so what do you call men? Eaters. What's eaters? Phages. Got this point? Okay. What are the eaters here? Monocyte, eosinophil, and monocytes are the largest cells. So does this makes the big eaters or the small eaters? Big eaters. What are the big eaters? Macrophages. Got it? Macrophages. So it's not enough to remember men are the eaters. Some of them are small and some of them are big. One of them is big. Monocytes are big cells, big eaters, which is called macrophages. How about the other two, eosinophil and neutrophil? These are tiny cells. So they end up making what? Microphages. Is this point clear? Okay, so this is number one. What else do I want you to know? This is how it looks like. Look at the monocytes, big cells, so they make the big eaters. Look at the eosinophil and the neutrophils, small cells, small eaters. Okay? All right. So what do I need to know? What I want you to know besides the phages? Which one make the macrophages? Monocytes. Which two make the small eaters, the micro? Neutrophils and eosinophils, the EM. Okay? All right. So this is one information. What else? Neutrophils, you need to know that this is the vast majority of cells are neutrophils. Okay? Most of the cells, this is the big number, 70% are neutrophils. And the most important piece of information that I want you to remember is if you see these neutrophils, the number increasing in the blood. Did you do like blood analysis before in the laboratory? It should be part of the annual physical examination. Did you do it before? They should give you the numbers. They tell you like this is the neutrophils, this is the eosinophils, this is called differential count. They should give it to you, or at least they look at it and tell you. If you, I ask for mine, I look at it. But if you don't, they will tell you your blood is okay. But what they are looking for or looking at, they look at all these five. I need to know details. Okay, you don't just give me like a bulk number and you tell me your white blood cells are 15,000. Yes, which one? That's not enough, right? What's the average? 5 to 10. Yours is 12. It doesn't mean anything. I still have no idea what are you talking about. Like it's more than normal. And which ones, right? So each one of those, if it is high, there is a meaning for that. And the meaning comes from the function. If the neutrophils are higher than normal, remember this word, bacteria. Okay, bacteria. By using this, you can, by the way, you can look at your blood analysis and you can tell, you don't have to be a doctor, just by this. Give me the blood analysis. I look at it. I see my neutrophils are high. I will say to myself, it looks like I have bacterial infection. Any type of bacterial infection. Okay? This is for the neutrophils. What's the other thing? So all of this, all what I want you to know is 2 slides. I want you to know the following. The vast majority, 70% are neutrophils. Number two, if it's increased, it means bacterial infection because this is their job. They fight bacteria specifically. Okay? It means bacterial infection. And number three, macrophages. Got it? Anything else is extra. It's okay to look at it, but this is the bottom line. And here are the neutrophils. Eosinophils. What's the first thing that you already know? Macrophages. This is one. What's the other thing? The other thing is if it is increased, it means either you have allergy or you have parasitic infection. I'm summarizing everything for you. I give you the bottom line only. If I give you your blood analysis and you see that eosinophils are high, what do you say? You say, I either have allergy or parasite infection. Do we know the parasites? The worms? I have any type of parasite. It can be protozoa. That's it. You see a eosinophil, I say to myself, it looks like I have allergy or parasite infection. Okay? So this is what it means. Any other thing you already know, it is the macrophages. How about the basophils? Basophils, inflammation. One word, inflammation. Inflammation. Basophils, inflammation. If I see it high, I will tell you you have inflammation. This is one. The other thing is, since this is for inflammation, this is the one that's involved in it. Do we know the inflammation? If you got inflamed and you see red, hot, did you get inflamed? Everybody got inflamed, right? Give this inflammation. You see this spot is red, raised, painful, right? This is called inflammation. Who is responsible for this? Basophils. How do you do it? Can you tell me if you get inflamed before, how does it look like? Red? What else? Swollen? Hot? Painful? Isn't it? Okay, so who's responsible? Basophils. How the basophils make this? What you just told me. It's swollen and red, and how did that happen? By releasing two H's, histamine and heparin. And you need to remember this. Histamine and heparin. This is how they do it. What do you mean? Like if the basophils what is responsible for all what you mentioned, which is how the inflammation looks like. How did the basophils did it? What's the histamine is doing? Histamine is a vasodilator. It dilates the vessels. So what? If I dilate the vessels, more blood come. Make sense? More blood come, and more blood squeeze out. So this area will become what? Swelling, right? What else? The more blood, do you remember the temperature of the blood? Isn't it higher, 38? So this area will become hot, right? And because of this squeezing on the cells, pain. So all of this is happening because of histamine. How about heparin? What's the heparin is doing? Heparin is anticoagulant. Why do you need anticoagulant? Because I have inflammation. There is foreign body, but there is something happening, right? There is infection, there is foreign body. Why would you have inflammation? Did you think about it? If you have inflammation, did you ask yourself why I'm having inflammation? It can be like a piece of wood or a pen or infection, or it has to be something foreign, right? And you need to fight. In order to fight, you need more blood to go to this area. How to make sure more blood is coming to this area? Dilate the blood vessels with histamine, prevent blood clots, because if the blood clots, it will stop the blood from coming, right? It will block it. So no blood will come. So I need to make sure that there is no clot, and I dilate, more blood come to the area, and this area becomes swelling and hot and painful and all of that. Clear? So basophils, inflammation, and two H's. This is what I want you to remember. Inflammation and two H's, heparin and histamine. This is how the basophils looks like. Monocytes, you already know. What's number one? Macrophages. And this is the most important thing to know. These are the largest of the white blood cells, and they make macrophages. This is how it looks like. Lymphocytes, I want you to remember this. Specific defense. Specific defense. Okay? What's a specific defense? I will give you a brief idea. I'm not going into the details. We have non-specific defense to defend you and specific defense to defend you. Non-specific means it defends you against anything. This is what non-specific means. Anything. Your skin defends you and protects you against anything or something specific. Anything. What if a chemical come? No. Foreign body, bacteria, virus. Does the skin differentiate? Does it differentiate between different things? Like bacteria is okay, but virus is not? No. It block everything. That's non-specific, right? You have your tears, for example. Any secretions, whatever it is, they kill anything. So we call that non-specific. Okay, macrophages and microphages, the phages in general, they eat. They eat what? Do they eat something that's very specific, like just virus B, hepatitis B? That's it. They eat anything. They eat anything. Any foreign body, anything that's this is as simple as this. They eat anything that's not supposed to be in your body, period. Like what? Like anything, whatever it is. Is that specific? No, it's not specific. How about the specific? The specific is lymphocytes. Specific means I have the non-specific. They are protecting me. Everybody's working, doing his job, and I am the specific. I'm not going to get involved until I see what am I specified in or my specialty, and I will take care of it. If I am the lymphocytes for the hepatitis B, that's it. If you don't get hepatitis B, I'm not doing anything. Okay? This is exactly like this. I always, to make it more simple and clear, the police cars that goes around, these are non-specific. Do they only stop you like if you break the light or anything else? Like if your car stopped on the side, don't they stop and see what's wrong? If there is a fight, they stop, right? Anything. These are the non-specific ones. An issue. There is an issue. We have to go. Specific is like the terrorist fighting group or whatever you call it. Okay, the drugs department in the police. Do you think the if you work in that um, department, do you think if they find you violated the light, they will stop you? They will leave you alone, right? This is not my job. I'm specific. Only if there is a drug issue, you let me know and I will come and help. I am specific. Is that clear? This is the lymphocytes. The lymphocytes is like these type of specific police. I don't get involved unless there's some, and they are very powerful, but only in my area that I'm specific in. And this is called the lymphocytes. So specific defense. Okay, so now there are three types of these lymphocytes. Okay, just like if I ask you what kind of specific departments in the police, you can tell me there is like for drugs and for terrorism and for arms or military weapons or whatever, right? There are different departments. There are different types. What are the different types here? T cells, B cells, and natural killers. T and B, both of them, we make them in the bone marrow. Both of them. But the name doesn't come from where did we make it. The name come from where did you activate them. Activation. You make both of them in the same factory, in the red bone marrow, but you activate the T. What's the T refers to? We talked about it before. Not thyroid. Another gland. Huh? Thymus. Do you remember the thymus, thymosin? It was in the endocrine system. We did it. So this is activated in the thymus. Thymosin activated. That's where the name came from. T is the first letter of thymus, and this is where it's activated. How about the B? The B is activated in the bone marrow. We make it in the bone marrow? Yes. We also activate it in the bone marrow? Yes. So what's the first letter of bone marrow? B lymphocytes. So where do we make B and T? Bone marrow. Where do you activate the B? Bone marrow. Where do you activate the T? Thymus. Okay? This is one. Number two, do they have the same job? No, they don't have the same job. The T lymphocytes, they make something called cell-mediated immunity. Cell-mediated means they work by themselves. They attack by themselves. While the B lymphocytes are responsible for something called humoral or antibody-mediated immunity, meaning they do not fight by themselves. They shoot antibodies. It's antibody-mediated. Okay? Before doing that, the B cells maturate and become plasma cells, and then they produce the antibodies. If that doesn't make sense, let me say it in another way. If there is an issue here, there is a fight or whatever it is, somebody's carrying a weapon or whatever, and the police come. If this is like 5 policemen, not all of them go and engage, right? One of them will be staying away with a weapon, with a gun or something, and maybe two or something arrest him physically, right? So those that engage physically and arrest, these are the cell-mediated immunity or the T cells. Those that stay away just in case and they shoot from far away, they don't engage physically, they shoot antibodies, and these are the B cells, and we call that humoral or antibody mediated because they don't fight by themselves. They mediate the antibodies. They shoot from far away. They shoot what? Antibodies. Okay? But they have to differentiate into plasma cells or maturate into plasma cells in order to be able to produce the antibodies. The third one is called natural killers. And natural killers will kill. Where did you get that name from? Natural killers. So they kill the natural cells. Natural killers, right? So they kill actual cells. And that's where the name came from. They kill cells. What do they kill cells? For one of two reasons. If this cell is virally infected, or if this cell contains cancer, do you still need your cell if it contains cancer? No, you don't need it anymore. If it is virally infected, you know what the virus do in our cells? Destroy it. They not only destroy it, they take over, destroy, leave, and go to other cells. Do you need these cells that's virally infected? No. Natural killers will eat it, will kill it. Natural killers. So they eat cells or they fight, they destroy cells if virally infected or if it contains cancer, right? I always hear something like, why people still suffer from cancer if we have cells that kill the cancer cells? Yes, they can only kill what they can reach. They can reach like cancer in the blood on the surface, but they cannot like go deeper into the cells. They do the job, but it's limited. They cannot. There is huge research on these natural killers. They are trying to train it to penetrate inside, but still in early. I have some of my friends working in that research in Texas, and he told me he's working on this one specifically. Natural killers. They are trying to play in the genetics and let them not just fight what they can see. They try to penetrate into the cancer cells. If they succeed in that, that might be a good treatment for cancer. But right now, the normal ones, they just attack what they can see, which is not everything. Okay. Two words or two suffixes that I want you guys to remember: pinia and cytosis. Write it down. Pinia and cytosis. You can put it at the end of anything and you get the meaning right away. Pinia, low count. Low count, low number. Cytosis, high number. You can play with those two words and you get the meaning. So we are talking about the white blood cells now. What's leuco means? White. So what's leukocytosis? High number of white blood cells. How about what's leukopenia? Low number of white blood cells. How about this? Erythropenia. Penia. Low number of. This is the first time to hear it, right? But you can still translate. If you put the things together, you get it. How about erythrocytosis? That's it. Easy. Just use those two suffixes and it will give you the meaning. So leukocytosis is high white blood cells. What do you mean by high? I mean 15,000, 20,000, 25,000. This is called high. No, just higher than normal. That's enough. Higher than normal is cytosis. I'm just explaining what's leukemia then. So what's leukocytosis? Higher than normal white blood cells, right? 15,000 is high, 20,000 is high, 25,000. But 500,000, no, we don't cut that high. That's crazy high, right? So this is not cytosis. This is leukemia. This should be cancer. It's not leukocytosis. It's extreme leukocytosis. It's not time and a half. It's not double. It's like 100 times as much. Leukemia, cancer, and this cancer continue on producing all the time. So you have huge number of white blood cells, and the question is, if I have huge number of white blood cells, they are going to like defend me more? No, they are all dysfunctional. Do you remember when I told you about the pizza? If I give you enough time to make pizza from scratch, you give me perfect pizza. If I make you hurry up and produce more, you give me like 50-50, not perfect. And if I give you more, you give me anything. Can you eat like a piece of dough like this? I give it to you. Can you eat it? It's not pizza. This is not white blood cells. It's dysfunctional. Okay? So yes, we have huge number, but it is not working. Leukopoiesis, what do you think? You figure it out. The process of formation of the white blood cells. Okay? Yes. What's the grandmother cell for all blood cells? You should know. You should know. She said it. Does anybody else know? What's the mother cell, like the grandmother, the very first, the stem cells? Hemocytoblast. Yes, hemocytoblast. You have to remember this. Hemocytoblast. And the hemocytoblast will give you myeloid stem cells and lymphoid stem cells. White blood cells come from myeloid stem cells. Do you remember we talked about this? The grandmother is hemocytoblast. It gives you two mothers, myeloid stem cells and lymphoid stem cells. All cells come from the myeloid. The only exception is one of the white blood cells, which come from the lymphoid stem cells. What is it? The name gave it away. It's called lymphoid stem cells. Which cells? Lymphocytes, yes, lymphocytes. It's called lymphoid stem cells. So what does it give us? Lymphocytes. Everything else, myeloids. So for regulation of the red blood cells, what's the hormone that regulates red blood cells? Don't tell me you don't know. What is the hormone that regulates red formation of red blood cells? And where does it come from? Who tell the red bone marrow to produce more red blood cells? APO, which is called, what's the full name? Erythro, what? Erythropoietin. Erythropoietin, right? This is the where does it come from? From the kidney, right? How about this? Who stimulate the white blood cells? Something called colony stimulating factors. Colony stimulating factors. These are factors that stimulate the white blood cells colonies, colony stimulating cells. Okay? Some of them stimulate the granulocytes, the cells that contain granules, and some of them stimulate the monocytes. So we call it the GM, colony stimulating factor, or the M, colony stimulating factor. GM, it stimulates both of them, granulocytes and monocytes. This stimulates monocytes only. And there is multi means multiple, that stimulate all of them. So this is kind of equivalent to the erythropoietin. Here is the process again. What's this grandmother cell, stem cell? What is it? Can you say it? Hemocytoblast. Here. What's the mothers? Myeloid and lymphoid. Everything come from myeloid except lymphocyte come from? Yes. Good enough to know. Here are all the types, red blood cells, white blood cells, and platelets. When I told you granulocytes, the G, do you see this G, colon stimulating factor? These are the granulated cells. What do you mean granulated? They contain granules. And look at the name, Ben. Do you remember men? Men? This is similar, but bin. So the way I remember it, the way I memorize it since I was in the medical school, men, bin, men, eaters, bin, granulocytes. Okay, and bin, En is the same. So the B is basophils. Bin are the granulocytes. Obviously, the other two are not. Okay, we're almost done, but we will stop here.